Basically, what happens is when newborn baby comes to home, parents are very confused because different relatives, friends, and elders in the family give different kind of advice to the parents, and because of that, the parents are very confused. What is right to do, what is wrong to do? Because of the advices, some of them are actually really good advice, and some of the advices are actually scientifically wrong. So today we will look into what are the right things and what are the wrong things, and we will highlight 10 important mistakes which you should not make for your child's care if the baby is less than 6 months old. So number one mistake which happens is not giving vitamin D drop to the baby. See, vitamin D is required for baby from birth to 1 year, and the daily requirement is 400 international unit. So what you should do is simply buy a vitamin D drop which has 1 ml equal to 400 international unit. So which has 400 international unit in 1 ml. So what will happen is every day you should give 1 ml of the vitamin D drop, and there is no need to give morning or evening. Anytime you can give. There is no specific need to give it in morning. You can give either in morning or evening or any time in the day. It will work effectively at whenever you give it. 1 ml per day. Sometimes parents are confused because vitamin D drops may come in different strengths, like 1 ml having 800 international unit of vitamin D. So if you are using 800 international unit per ml of vitamin D a drop, then you should give 0.5 ml of vitamin D to your child every day. But generally, for like easily remembering, I would request you can buy the vitamin D drop which has 400 international unit in 1 ml and keep giving 1 ml till the baby becomes 1 year. I have made a separate video on vitamin D for babies. You can watch that video on our channel. Number two mistake is applying different things on the umbilical cord. In India, people apply kajal, ghee, or sometimes they apply gobar, cow dung on the umbilical cord, which is extremely wrong, and these things can cause infection in your baby's umbilical cord. So what you should do is keep the umbilical cord dry till it falls. So generally the umbilical cord falls on 7th to 14th day of life. Till then you should not touch it regularly, just leave it alone. It will dry by itself and it will fall off. And till the umbilical cord falls off, you should not dip bath. Should not pour water on the baby's body, and rather do a sponge bath by wet cotton cloth, and with clean water you can wipe the body all around to do cleaning till the umbilical cord falls, and after that you can do dip bath for the baby. So keep the umbilical cord dry, don't apply anything on the umbilical cord. That is the best thing you can do to prevent infection on the umbilical cord. Third mistake which parents make is immediately after birth to give good tea, sugar, or honey to the baby as prelacteal feeds, and that is a practice which is there in many places in India, that elders in the family come and give these things before baby starts breastfeeding. This is a very harmful practice. It can cause serious infection in children, and especially honey is not recommended for children who are less than 1 year old, because it can cause a disease named infant botulism, which can be life threatening. So please avoid giving anything to the baby immediately after birth. You should give immediately after birth to baby breast milk, and that is the liquid gold. That is the most important thing and most needed thing for baby. Immediately after birth you should start breastfeeding. Give mother's milk to baby. That will give immunity, that will give calories, that will give lot of benefits to your child in the long run also. So always try to initiate breastfeed and don't give prelacteal feed to your child. Fourth mistake which happens is applying kajal in baby's eye. Please don't apply kajal in baby's eye, because kajal can cause a lot of problems. First of all, when you are applying, it can cause eye infection with your hands. When you are applying, your hand can put an infection into baby's eye. Second thing which happens is kajal can cause allergy in the eye, which is called kajal conjunctivitis. Third thing which happens is the kajal particles, they actually block the hole which carries the tears from the eyes to the nose, and thereby baby's eye become watery. So that is the disadvantage of putting kajal. If at all you want to put kajal to save the child from buri nazar, then you should put it on the cheeks or on the forehead or on the soles of the baby or behind the ear to complete the ritual, but please don't put it in the baby's eyes. Fifth mistake which happens is during massage. Massage should not be done with any ghee or mustard oil, because these things are very thick. It can block the baby's skin pores and cause rashes. Especially mustard oil has a lot of irritants which can cause rashes in the baby and make the skin dry and rough. So don't use these things. If you want to use, you can use coconut oil for baby's massage, and that is healthy. It keeps the skin moist and very bright. So that is a very good thing. Second mistake with massage is sometimes people do very vigorous massage. They twist the baby's body in different way, hold the baby from hand or leg and lift the baby like that. That can cause serious injury to baby's delicate body. So please avoid this kind of efforts. Just do gentle massage. And one more thing, the massage should ideally be done by a family member, and do it very gently. It should not actually employ any dye for the massage, because sometimes what happens is dye may have some minor infection which can get transferred to baby and can cause problem for the baby. Second is, these dyes sometimes can do very vigorous massage which will be harmful to the baby. Another mistake which you should avoid while doing massage for baby is, don't put any oil or anything in the nose, ears, or the potty hole of the baby, because sometimes people think that putting these things will clean these areas, but rather they end up introducing infection in the baby's body. So please don't put any oil in these things. To clean these things, there are specific instructions which I have given in other videos. You can watch those videos. Sixth mistake which you should not make for baby is, while playing with the baby, you should not vigorously throw the baby into the air, or don't shake baby's body by holding it and shaking it backward and forward, because these things can cause serious injury to delicate body of the baby. So please do play with the baby, but in a very gentle way, and like I mentioned in the previous video, always support the baby's head with the hand till the baby is learned to hold his head by itself. Seventh mistake which happens is not changing diaper frequently. Sometimes what happens is, when we use disposable diaper, babies pass urine and potty, and the disposable diaper absorbs the moisture, and the baby does not feel uncomfortable. But what happens is, the stool and urine material comes into contact with the baby's skin and irritates the skin, and then later on baby develops rashes. So what you should do is, you should frequently keep changing diapers every 3 to 4 hours when the baby has made it wet. Even better is to use a cotton diaper for baby, which allows better circulation and prevent rashes. I have made a detailed video on diaper rashes. You can watch that video for understanding how to use diapers in babies to prevent diaper rashes. Next most common mistake which parents make is to give water to the baby who is less than 6 months old. Sometimes parents are afraid that it is the summer season, my baby may require extra water, so why should not we give some little bit water to the baby? So don't give water to babies who are less than 6 months, because what happens is, in the mother's milk there is 80 to 90% water, which can easily meet the baby's water requirement till 6 months of age. So if you feel that your child needs more water and baby is less than 6 months old, then please give frequent breastfeeding. That will suffice for the baby's water need. Even the formula milk is made it with water, and that has adequate water to meet the water requirement of baby. So even if you are doing formula feeding, you can continue with the formula feeding alone. Don't give separately water to baby. Actually what happens is, if you give extra water to baby, that will fill the baby's small stomach, and the baby will not feel thirsty or hungry, and baby will not drink enough milk, and that will cause less calories going into the baby's body, because the water does not have any calories. So baby's tummy will be filled with water, and baby will not drink milk, and calories will be less in the baby's body, and baby will not grow, and sometimes weight loss also can happen. So please avoid giving plain water to baby who is less than 6 months old. Next common mistake which happens in India very often is to give cow milk at a very early age. Sometimes when the mother's milk is inadequate, parents start giving cow milk at a very young age, even before 6 months of age. See, cow milk is actually having cow milk protein, which is difficult to digest for babies less than 1 year old, especially those who are less than 6 months. So please don't give cow milk as a milk replacement till 1 year of age. After 6 months of age, you can use cow milk to prepare some cereal mixture, like you can use cow milk to cook oats, dalia, or any kind of poha, and make a cereal with cereal porridge with the cow milk. That can be used in small quantities for baby who has completed 6 months, means who is 180 days above. But don't use cow milk as a milk replacement, mother milk replacement till 1 year of age, because cow milk protein is not easily digested by less than 1 year old baby. Second thing, cow milk has a very high sodium, which can actually cause put load on the kidneys of the baby. Third is, cow milk has less iron, so that also can cause iron deficiency. So basically till 1 year you cannot give cow milk as a milk replacement. After 1 year, definitely you introduce your cow milk to baby, and you can watch that video on my channel. I have made a video on how to give cow milk to the baby, so that you can watch for giving children above 1 year cow milk. Finally, there is one more common mistake which parents make, is to give gripe water when baby is having pain because of gas in tummy or colic pain. So basically gripe water is not recommended in any medical treatment for gassy babies. So please give simethicone based drops. Doses can be confirmed by pediatrician, but generally we give 5 drops per dose to babies who are less than 6 months, and 10 drops per dose for babies who are above 6 months. Up to 3 times a day is fine. Simethicone based drops you can give, but you have to confirm the diagnosis first that the baby is crying because of the gas with your pediatrician. Second thing is the gripe water is unregulated product. It can be harmful because the composition is not fixed. Different companies make gripe water with different compositions, and it can have some things which can cause problem for the kid like sugar, peppermint, soda bica. And initially the gripe water which was designed had also alcohol in a very high quantity that could be extremely harmful for the babies. So please avoid gripe water use for your baby when the baby is having gas. Rather you use simethicone based drops which will help. And I have made a detailed video on how to relieve colic pain in children, which is going to be very helpful for you. Please watch that video on our channel. Thank you so much.